All right, welcome back, everyone. Joseph Phillips here, Clearwater BioAcoustic.com. We're going to talk about urinary tract infections. But before we do, again, as always, little disclaimer. This is intended for education, research, and data collection. All terms are offered in frequency equivalents. These statements have not been evaluated by the Food and Drug Administration, and this product or service is not intended to diagnose, treat, prevent, cure disease in any way, shape, or form. And as always, please consult your healthcare provider. All right, so for those of you who are new, kind of the way it works, schedule time, give me a call, record your voice. We take the frequency markers in your voice and convert that into a report. And the report kind of gives us a general roadmap of what's going on with you. And so these are some of the results from a client this last week dealing with constant recurring urinary tract infections. This client had a spinal injury, so that's important to note, when she was 18 years old. And so we'll talk a little bit about that as well. But these are some of the things that came through the reports. You can see right on top there, the Lyme Borrelia bacteria came up. We could see inflammatory markers, glutamate decarbolase came up, which would be an indication of glutamate excitotoxicity, neural inflammation. We're also finding H. pylori as well. We'll kind of get into that. And the ALS gene also came up. So that's important to note. We'll get into that a little bit as well. The muscarinic acetylcholine receptor 2 came up, and then also aluminum. There's other factors at play in relationship to urinary tract infections, but let's get into some of this material and kind of cover why we think she's had issues ever since her spinal injury. So pretty much dealing with this her whole life. And so we can see some data out there that 9 in 10 ALS patients infected with Lyme bacteria. That's a pretty high number. And so you could almost bet that anyone dealing with ALS is almost definitely almost every time going to have the Borrelia or some other strain of the Lyme bacteria. So makes it about 1,000 times greater if you do. So there's definitely connection with ALS and Lyme disease as well. So there's a lot of material out there you can go look through. A lot of people are getting misdiagnosed. People are missing the Lyme bacteria and the testing. Testing is only about 50% accurate. That's why what we do is superior because frequency determines physiology, and we know that these reports are highly accurate. And so some ALS symptoms, muscle weakness, trouble swallowing, breathing, cramping, stiffness, speech loss, issues with the tongue. Interesting note, the tongue came up inflamed in our reports with this individual as well. And so that just adds more evidence of what we're looking at as well. So people might also be experiencing initial symptoms, hard time buttoning their shirt, maybe turning a lock or key in a lock, just little subtle things like that that really start these symptoms of ALS, which we believe is directly related to Lyme disease. And so does ALS have anything to do with urinary tract infections? It does. We were able to find several studies on ALS and urinary tract infections, and also urinary tract infections in relationship to Lyme disease as well. And so there's also material out there as well where you can find that a spinal cord injury will also lead to a urinary tract infection. So there's a lot of different factors at play when you're talking about UTIs, and all these did come through our reports that would indicate. Now, mind you, that her current healthcare providers haven't been able to figure out what's wrong with her in, I think, 20 years. And we figured it out in less than 24 hours. The muscarinic choline receptors, what are their job? They're a neurotransmitter in the body, but the M2 specifically, one of its primary jobs is to control bladder voiding, the contraction of muscles. as well. And so you can see on the right-hand side of your screen, the M2 and M4 work to inhibit what's called CAMP, cystealic adenosine monophosphate. And so when you have overphosphorylation, it's called, of certain pathways, it could lead to other complications. And so one of those complications is an overactive, what's called protein kinase C. And that leads to a whole host of issues. You may or may not be familiar with the AKT mTOR pathway, but when those pathways are overactive and overphosphorylated, it'll lead to many, many diseases, not just issues with the urinary tract. And so that's important to know. But another thing that will also activate protein kinase C are what's known as DAGs, diglycerides, and you can find those in most people's houses, in their refrigerators, in their cupboards. Bad news. And so you want to make sure that you're staying away from processed foods because that will also add to the complications of urinary tract infections through the activation of protein kinase C, which inhibits the ability for the muscarinic receptor to do its job. And so important to stay away from processed foods as well. Urinary tract infections and H. pylori, is there a connection? Absolutely. It's a great environment for H. pylori in the urinary tract. And so this will lead to what's known as bladder lymphoma. And this can also be passed through sex, fellatio, things like that. Those are some of the reports we were reading. And so that's another issue in relationship to urinary tract infections is H. pylori, and those did come through our report. So not only are we looking at Borrelia, muscarinic choline receptors, ALS, but also H. pylori, which would give us a good reason why this person's had recurring urinary tract infections her whole life, especially after the spinal cord injury. Other factors at play are going to be food allergies. Did those come through our reports? Yes. Aluminum, yes, those came through our reports. Cadmium, yes, those came through our reports. Low estrogen, yes, those came through our reports. And so there's a lot of issues in relationship to urinary tract infections, and just about every single one of them came through our reports. And so I hope this helps people figure out what's going on with them, maybe in any way, shape, or form. And I hope we've get some good value for you as well. And so you can always visit the website if you want to learn more about what we do, www.clearwaterbioacoustic.com, and we'll try to get some more of these PowerPoints together for you in the future when we come across new information. And so thanks for your time, and I look forward to hearing from you soon.